revealed during the stakeholders forum that IMCC organized. Save Ghana, with a research background, was interested in conducting the study. Of course, IMCC, International Medical Cooperation Committee, was also interested and committed to make sure that this comes to pass.
We held a stakeholders meeting, and it came out as a concern that men's participation in CT services is low in the district. The number of people who will want to be tested to know their HIV status could increase in the district. By so doing, we will know all the people that might be victims of the circumstance. In other words, those who might test positive, and therefore we will give them the opportunity to start treatment to prolong their lives.
I think that our focus is on men. Men, because of the fact that the patronage for men is very low. And I think that it is men who know what their perceptions, or who can tell better why they don't want to come for CT services. If you take if me, for instance, goes to Nobilo to do something, they won't understand anything. No. You see, because of the language barrier. So what I think is that if it is appropriate that somebody like Samad, who knows a lot about drama, if he does the right up, then go get people who will, who, for instance, understand English, who can do the drama in the language that the people understand.
After you have spoken to them, then the play comes in. What do they think? Does it change their perception?
What do we learn from it, or what is it that you saw in the play?
The method that we use in conducting this study was PRA, Participating Rural Approach, and that is a model that you can use to pick data very fast, and it with less time and less resources. As part of the model, we use information pyramid. That is to help us to be able to capture all the segments of the aspect that we want to cover.
We will have this thing, the information pyramid in the form of a triangle. Okay. So we're starting from the national level. What policy is there that affects men's perception of the city, to the regional level, and to the final to the community level. The top one is not necessarily the least important one. It means that what is happening at the national level, but the one at the bottom, that the community level, is where our concern is, and that is the most important one.
So that the point I'm making is that this is something that should guide us, either what we should know and what we should ask.
Yes, I think the first reason is that to guide us in our data collection, so that we don't go to the field to collect the data and only come to realize that we have left a segment or an aspect of the community that could affect their perception. You know, women have a lot of these groups. Yes. Not that they don't call them Zusu associations and all that. So they're able to discuss these things. Yes. We also find out whether men also have these groups. You see? Yeah. Now, our men, do they have these groups? Yeah, we prefer
well, when we go, we will find out.
We prefer to go to drinking. Now that we have finished with the information pyramid, I think let's start looking at how we will develop our personnel. What I'm trying to say is that once we can have 3 or 4 broad categories, or headings or subheadings, where we know we will ask them questions under.
Whether the city centers are accessible to the people. Okay. We will also look at if it is accessible. Are the people, why are they not going for it?
One of the most important aspect of this study is the training. The training of those going to do the questioning, where we train them on how to observe, how to ask questions, how to interact with people at the field. These are things that will help in coming out with the right information.
This morning we are here at this facility to
with our volunteers that will be conducting a research on the perception of men on CT in the Sisaala East District, and we have picked those volunteers from 3 sub-districts. They are health workers in those communities. We'll be visiting 6 communities in all. Today, we'll be learning the method that we'll be using, which is the rapid participatory approach, to be able to gather our data quickly and not wasting much time and resources.
What will you do if you are afraid to have HIV/AIDS?
What will I do?
Yes.
If
you are afraid you have HIV/AIDS,
I'll go for counseling and testing.
Did you say counseling and testing?
Yes.
Where did you hear about it? Where?
Where?
Yes.
I heard it on air.
When you ask a question and everybody's keeping quiet, nobody's answering, it means they may not understand the question. Reframe it in a different way. When you ask a question like you were saying, then look at her. She will know that you are looking at her. You are interested in what she will say.
We chose to work with Ghana Health Service personnel on certain reasons, and that is to improve their capacity to be able to do such interviews themselves, and also because they will also be part of the implementation process when we are through with the finders. So it will be good to get them involved so that they will know the first-hand information on what is coming from the field.